Hi, I'm Dr. Jen from the Tummy Clinic.
Hi, I'm Dr. Tracy, and we are both naturopathic doctors.
Today we're going to talk about some low FODMAP foods that you might find in your breakfast meal. So, Tracy, can you just tell us what low FODMAP is?
Sure, low FODMAP foods are foods that don't have the highly fermentable carbohydrates. So when we're talking about high FODMAP foods, we're talking about things that can cause a lot of gas and bloating because they're so highly fermentable when they're eaten by our gut microbes. So some of these foods are lower FODMAP, which would be your oranges and your kiwi. And almonds in high amounts can be higher FODMAP, but we put them slivered here. So if you're consuming just a few of them, like less than 10 almonds, it would be considered low FODMAP, so lower gas forming.
So tell me then, so you said that oranges and kiwis are fine, they're low FODMAP. Can you see anything on this plate? So I would look at this and think, wow, this is a great, healthy, well-balanced breakfast. We've got fruit, we've got proteins, we've got grains, but what on here might be a high FODMAP that's gonna trigger somebody?
Yeah, so if somebody ate this whole, guacamole here, it might produce, because of the high amount of avocado, it might produce some gas and bloating for them. So I would recommend using this as a spread. And we do have a spelt bread here that is low FODMAP, so using it as a spread would be ideal. Apples can really be gas forming for people. Okay. So this is something that, I suggest that, work with the dietitians at the Tummy Clinic, figure out whether or not apples is a trigger for you, and go from there.
Okay, so just because apples are on the list of a high FODMAP food, does that mean everybody that has IBS needs to avoid apples?
No.
Okay.
Yeah, so it's important when you're working with the dietitian to kind of, figure out, your particular triggers. So no two IBS patients are alike.
Okay.
And as an IBS patient, I don't do well with wheat, but I can have a few apples and be okay.
Okay. And if I find that apples are my trigger, I don't have to avoid them for my whole life, right?
No.
Okay.
Yeah.
All right. So that's a breakfast in a snippet. If you want more information and try to figure out what your food triggers are, you can contact us at thetummyclinic.ca.